Coming up on Magical Medical Tour with co-host Dr. Glenn Woolman and special guest Dr. James Lake, an integrative holistic psychiatrist. Globally, 1/3 of the adults deal with some form of anxiety. What are the differences between how the East and West view anxiety? What are the causes and treatments? This and more coming up next here on YHTV. This week's episode is brought to you by Support the Mountains Herbal Parasite Cleanse. This formula targets the small and large intestinal tracts and larvae, the most broad-spectrum formula available today. 100% organic, formulated by Dr. Mikio Sankey, author of the Esoteric Acupuncture series. For 10% off your first bottle, visit shopyogahub.com and use the coupon code CLEANSE at checkout. Hello and welcome to YHTV's Magical Medical Tour. Thank you for joining us today for Anxiety. I'm Christina Suzuma, and with me is our wonderful co-host and medical guide, Dr. Glenn Woolman. Hello, Dr. Woolman.
Greetings, Christina, and greetings, everyone. Welcome to Magical Medical Tour. I am Dr. Glenn Woolman. I will be your medical guide today, along with Christina, as we travel through another quadrant of the healthcare galaxy this week in search of optimal health. So, Christina, right now we've got two world leaders with nuclear capabilities playing flinch. We've got earthquakes, hurricanes, wildfires, tornadoes, mass shootings, wars around the globe, people starving, people eating too much, health issues, and refugees moving all over the planet. I wonder if there's much anxiety out there.
Oh.
And that's the reason we decided to have our favorite holistic integrative psychiatrist, Dr. James Lake, who was with us on episodes 131 and 140. And today we're going to talk with him about anxiety. I think that's a big issue going on right now. But before we do, Christina, how do people get in touch with us?
Yes, thank you. Good topic right now. Now, at any time during this show, you can feel free to ask a question or make a comment simply by scrolling down on your screen and typing it into the comment box. And, you know, this show could have been recorded a month ago, 2 months ago, a year ago. Not to worry. Just post in your questions and we'll make sure if it's for our special guests, we will get it over to them. Or if it's for Dr. Woolman or myself, we will definitely make a point of answering you. Now, another way is to simply call us at 818-LETS-TALK. 818-LETS-TALK. And be sure to leave your name and contact information so that we can get back to you. Thank you so much, Doc.
You're quite welcome. So I think anxiety is a big thing that's going on right now, and that's why we've asked Dr. Lake to come back to speak with us about this. We're going to spend the entire program today on anxiety. Dr. Lake, as you may remember from episodes 131 and 140, was a clinical assistant professor in the Department of Psychiatry and Behavioral Medicine at Stanford. He's also an author of many articles and books, and he has ebooks that are out there that are for mental health that you can look at, and we'll have a link to that, and we may discuss in a little while. So welcome back, James.
My pleasure to be back, Glenn. And Christina, thank you for the opportunity.
Hello, hello. Thank you for being here. We need you right now.
So, James, let's get right into it. Anybody that wants to find out about Dr. Lake can, as I said, look at episode 131 and episode 140, and that'll tell you many things about him. And you'll learn more today, of course, but I want to make sure that we have as much time as possible to see about helping people with anxiety. So I guess the first thing is, what is anxiety?
Okay. Anxiety is a chronic condition that probably affects 1/3 of adults at any given time on the planet globally. It's associated with a state of tension, psychological stress because of uncertainty about one's circumstances because of difficulties that one may have in a relationship, at work, and in any area of social or psychological functioning. So depending on where you view anxiety from, you will see it as a different kind of thing. In Western medicine, we think of it as a chronic condition related to changes in neurotransmitters, which is the basis of treatment using medications. In Asian systems of medicine, Chinese medicine, Ayurvedic medicine, and so on, it's viewed as an energetic imbalance and is treated energetically. So depending on where you start from, you will understand anxiety in a different way, and you'll approach it in a different way.
What actually causes anxiety? I mean, you know, we know the signs and symptoms of it, like for someone with a sore throat, they might have a fever and difficulty swallowing, but we know the causes bacteria. So what causes anxiety? Is it hardware, or is it software? Is it neurotransmitters, genetics? Where do we go with that?
Very good question. All of the above would be my answer to you, Dr. Woolman. Some people are genetically predisposed to have anxiety disorders. For example, many people who have social anxiety are related to people who have social anxiety. Their parents may have had social anxiety. The same holds true for obsessive compulsive disorder, which is a kind of anxiety disorder. So there may be a genetic predisposition with respect to some kinds of so-called anxiety disorders. Changes in neurotransmitters might be related to chronic stress. An individual who is subjected to stress from difficulty in a relationship, difficulty in a work environment, or whatever stresses they may encounter. And Glenn, you named many that affect millions of people globally, billions of people globally at this time. Hundreds of millions of refugees. There's never been a time of greater crisis for dislocation of people, particularly in the Middle East, of course, and in Africa. There are dozens of fires raging as we speak within 100 miles of where I'm sitting. Thousands of homes have been burned. People have been killed. There is enormous anxiety about the direction of this country because of current political trends. I mean, there are compelling reasons for many people to have significant anxiety day to day. And so I'm talking about social causes, social issues, dislocation, if you happen to be a refugee, chronic uncertainty about your future income, your financial status, your health care, everything going on with efforts to repeal the Affordable Care Act and so forth are a source of, I believe, significant ongoing anxiety for millions of Americans at this point in time. So there are a lot of different ways to think about the causes of anxiety. And again, from the point of view of Western biomedicine, the idea is that chronic stress can lead to changes in neurotransmitters, and those changes in neurotransmitters result in a feeling of chronic uneasiness. This is the concept of anxiety from a Western medical perspective. And again, from the Asian medical perspective, it has to do with an energetic imbalance. I view these as different metaphors. I don't think we really can say what causes anxiety. I think it's quite different for each person in the context of his or her culture.
We know that everybody has anxiety. I mean, sure, you and I had anxiety in medical school when we had to take a test, but sometimes anxiety works on our favor to make us study a little more or practice. Before I did my first surgery, I was very anxious, and practicing more and learning more, it became an advantage. But for many, it's not an advantage. When we look at, the movie Moonstruck, where Cher slaps Nicolas Cage and says, "Snap out of it," right?
Right.
There are many people that can't snap out of it. What is it that's different about them than us that can snap out of it?
I believe by constitution, some people are more resilient in the face of chronic stress than other people. It depends on your upbringing. It's not clear what causes differences in resilience to anxiety, to responding to chronic stress, for example, in a way that becomes, I'm losing a word here, that interferes with your ability to function. day to day. Some people can go through the most difficult challenges in childhood or as adults, and because of their psychological resilience or their spiritual belief system that keeps them strong and resilient, they function well. Other people may have a happy, healthy childhood and have all the benefits of loving parents, but because they're more fragile, perhaps because of a genetic predisposition or some other stresses, they might become quite anxious early on in life.
Do you have any statistics, either in this country or worldwide, about how many people suffer from anxiety?
As I mentioned briefly, my understanding is that at any given time, globally, approximately a third of adults have significant anxiety. And during the course of the lifetime, it's almost certain that everyone will have anxiety. Typically generalized anxiety, but many people also experience transient panic attacks. Panic is quite common. Panic attacks may occur in the context of many kinds of other mental health problems. For example, agoraphobia, a fear of going outside of a place because you're concerned that you may have a panic attack. Panic attacks often occur together with agoraphobia. Panic attacks also occur in the context of post-traumatic stress disorder, of course, which is a major concern now with all the returning veterans from the Middle East.
And even people that were, say, in Las Vegas at a concert, I would imagine there'll be many of those that have post-traumatic stress disorder.
Mm-hmm. Yeah, you can anticipate that. Of course, all of the people who were wounded escaping the mass shooting in Las Vegas last week will have some degree of what's called post-traumatic stress for some time, and hopefully they'll find adequate care addressing those issues.
You mentioned neurotransmitters. I wonder if you can elucidate that a little bit more. I think it's fascinating that we, as scientists and physicians, have even found the concept of neurotransmitters and understanding the way they work in the nervous system. Could you talk about that for just a moment or two? Sure.
Many neurotransmitters are related indirectly or directly to anxiety disorders. There is not a clear, discrete causal relationship between a particular neurotransmitter and a specific anxiety condition or disorder. However, neurotransmitters including serotonin, norepinephrine, dopamine, and gamma aminobutyric acid are related to various degrees with anxiety. Chronic anxiety, for example, can cause a relative increase in the level of norepinephrine in the brain, which is kind of a sister of epinephrine in the body, which is one of the more activating neurotransmitters. And chronic stress, chronic anxiety states will cause an upregulation of norepinephrine in the brain.
And we'll talk about this in a little while because that's where we get into some of the treatments of the anxiety disorders. But it's not just one disorder. You spoke about panic attacks and post-traumatic stress disorder. There's a number of mental issues that go into this kind of a disorder. Can you briefly mention some of them? You mentioned a few already.
Can you clarify the question, Glenn? I'm not sure what you're asking.
I just wanted to talk about, we talk about anxiety disorders, and you mentioned post-traumatic stress disorder, panic attacks. There are many areas when we look at the DSM and a psychiatrist is trying to do a differential diagnosis. There are many categories that can fall into this in some way. Can you talk about that?
Of course. So as a psychiatrist, as a Western medically trained physician, specializing in mental health, psychiatry, when a patient comes to us with a complaint of anxiety of whatever type, could be general anxiety, it could be panic attacks, it could be something following a trauma, and so forth, obsessions or compulsions. The first task as a medical doctor is to make sure there are not underlying medical causes of the person's symptoms. For example, hyperthyroidism is a frequent cause of anxiety, especially panic attacks. Heart arrhythmias, as you well know, Dr. Woolman, I'm sure you've encountered many patients with this condition, often result in panic attacks. So, in fact, the first experience of a panic attack in a person who was before that quite healthy and functioning well might be mistaken as a heart attack. An individual might have chest pain, a feeling of pressure, feeling of irregular heartbeat, for which they go to an emergency room. They're evaluated. They are medically cleared. They're ruled out for a heart attack, and they're sent to a psychiatrist with a provisional diagnosis of panic disorder. So that's a frequent presentation of panic attack these days. It can strike you out of the blue. People are going about their day-to-day life, and all of a sudden they're knocked down by a panic attack for no apparent reason. So there are, again, as we already talked about, genetic predispositions that might increase the likelihood that you will have an anxiety disorder, certain kinds of anxiety disorders at least. Certain medications or other biological substances can cause anxiety as a side effect. In fact, ironically, some medications in psychiatry used to treat anxiety can cause anxiety as an adverse effect. Some of these serotonin reuptake inhibitors, for example, sertraline, which is also called Zoloft, bupropion, which is also called Wellbutrin, are used to treat anxiety, to generalize anxiety, but they may also cause anxiety as a side effect or indirect consequence. So social pressures, psychological pressures, relationship problems, work stress. We've already talked about crises that people have been facing recently here. The mass shooting in Las Vegas, all the fires. All of these things can eventually result in a chronic state of heightened arousal in the autonomic nervous system, which manifests as anxiety in one manner or another.
You talked about genetics as a possibility, and as part of treatment, I'm looking a little bit maybe into the future right now for a second. If we find out at some point there are actual genes in the genome and sequences of genes that can cause anxiety, how do you think the American Psychiatric Association will deal with the possibility of genetically modifying us as organisms to treat that? And you can answer that as a representative of the American Psychiatric Society and also as a holistic integrative practitioner.
Mm-hmm. Okay, well, first I need to clarify that I'm no longer a card-carrying member of the American Psychiatric Association. I was once active in the APA, but involved in the work to bring alternative and integrative medicine to the APA. But I haven't been active in that organization for some time now. My thinking from my general reading and knowledge of this area is that there are many issues involved in your question. It's a very complicated one. There's the ethical issue, of course, of whether it would be ethically defensible to modify someone's genes or the genes of people who might be predisposed to anxiety, so that they would less likely experience anxiety. So these are ethical issues. In what circumstances would that be appropriate, defensible, ethically sound? In terms of the APA or pharmaceutical firms responding to a finding that may take place in the future of a gene or genes that underlies certain anxiety conditions, I'm sure that would lead to great interest and great excitement about the possibility of modifying those genes, or more likely, initially at least, modifying the expressions of those genes at the level of neurotransmitters using very specific pharmacological interventions. They can address and correct the neurotransmitter abnormalities that are associated with genes that are found in the future to cause anxiety states. Mm-hmm. So you can approach it in two levels, I guess, from the point of view of Western medicine. One would be to modify genes, and that results in some ethical quandaries that need to be addressed in that context. And second, probably sooner, because the technology exists to do that already, find pharmacologic interventions that can treat those neurotransmitter dysregulations associated with genes that cause anxiety.
Let's talk about that for a few minutes. Christina, do you have any questions before we talk about some of the treatments? Any thoughts right now?
No, I'm right on edge, wanting to know more about these treatments and from the East and West perspective.
You're a little anxious?
I'm anxious. That's why I get to bounce.
He said, Dr. Lake said there are 1 in 3, and there are 3 of us here talking right now. So I'm just wondering.
Well, I get my ball to relieve stress, remember?
There you go. So I guess it's either you or me, James. So
guessing it's both of us.
Yeah. That's possible. Well, then we are helping 3 other groups of people. They don't have to have someone. So in terms of treatments right now, what's available to us as physicians from the Western point of view first?
Mm-hmm. Okay, there are many treatments from the conventional Western point of view. And as you know, we're in the same business. These are medications that target neurotransmitters that are implicated in anxiety. For example, serotonin, dopamine, norepinephrine, GABA. These are the principal neurotransmitters that are treated using available medications. Serotonin reuptake inhibitors are widely used to treat anxiety disorders, and they're quite effective much of the time. I don't want to name particular medications because that would might appear as an implicit endorsement. My understanding is that most of them work relatively equally with respect to treating anxiety disorders. So it's about finding a particular medication that works best for each unique patient, given his or her symptoms and their history of treatment response before you see them, before you're trying what you're giving them at this point in time. In addition to SSRIs, there are medications that are often quite helpful for anxiety, depending on the type of anxiety. Beta blockers, as you know, Dr. Wellman, propranolol is being the principal one used for the treatment of anxiety. Buspirone, which also affects some of the serotonin receptors in the brain, are often quite effective for treating generalized anxiety. A medication called gabapentin is quite effective, I've found, for the treatment of generalized anxiety, even severe generalized anxiety. And then for more severe anxiety or for panic attacks, the benzodiazepine medications are frequently used, although there are appropriate controls in the number and the amount of benzodiazepines prescribed to patients, because as we know, they are potentially addictive, which can become a significant issue for patients who have severe anxiety disorders who might be at risk for taking more and more benzodiazepines, for example, clonazepam, diazepam, lorazepam, and so forth, to treat anxiety. And as they take more and more of the medication, they can develop tolerance to the effects of the medication, take more and more, and before they're aware of the problem, they become addicted to the medication. So in conventional biomedical psychiatry, we're moving away from prescribing benzodiazepines, habit-forming medications for anxiety, and we're focusing more on prescribing the non-habit-forming medications, such as the SSRIs, such as beta blockers, such as gabapentin, which can be quite effective without the risk of dependence.
You talk about risk and side effects. I see a lot of people, many of my clients that have come up with that never really had anxiety before, but developed some kind of a disease, say something in the hospital, a side effect of a surgical procedure that became devastating to their lives, and then they developed anxiety, and then they were also put on anti-anxiolytic medications, and now you've got this confusion of, is it the medication itself or an anxiety that's causing problems? How do you deal with that?
Mm-hmm. It's a very good question. you try to tease out what is what, and oftentimes it's difficult to know exactly what is what. For example, medications can cause anxiety. The appropriate expected response to the stress of a surgical procedure can cause anxiety, and the individual is experiencing both at the same time. So my understanding of situations like that, these would be primarily patients encountered in the inpatient setting in the hospital, would be that both factors play a role in anxiety. In that case, typically what happens is that the patient is started on a very potent anti-anxiety medication when still hospitalized. For example, a benzodiazepine like clonazepam or lorazepam. And over weeks following discharge, assuming they do okay medically, they're transitioned to a less potent anti-anxiety medication, such as an SSRI, and instructed to use the benzodiazepine as needed only to treat any recurring anxiety symptoms. Many of these patients also have significant pain, post-surgical pain, and the benzodiazepines and some medications used for anxiety and depression can be helpful for the management of post-surgical pain. So you follow a trajectory, managing symptoms as they arise, which are different in each unique case. And the idea is to manage risk, contain risk, which translates into using those medications that are less likely to be habit-forming, and transitioning from habit-forming medications like benzodiazepines to the non-habit-forming medications as soon as you can.
You talked about people getting addicted to the medications, and it becomes tolerance. Is there a possibility, like we're looking at now with antibiotics, that there's resistant strains of bacteria now? Will there be resistance rather than tolerance to some of these medications at any point?
I think the concept of tolerance is the one that fits the problem that we encounter when people take a potent benzodiazepine medication, because it has to do with what happens at the level of neurotransmitter receptors in the brain. It's kind of a pharmacologic mechanism. Resistance, on the other hand, as you pointed out, has to do with a microbe, a microorganism, developing genes that permit it to continue to stay alive and function in the face of a chemical that was lethal before now. They've evolved mechanisms to survive these antibiotics that until recently were able to eradicate them. So these are two different kinds of things. One has to do with a response at a genetic level by a microbe to a toxin. And that would be the case of antibiotics. And in the case of dependence in the context of prolonged use of benzodiazepine, it has to do with changes at the level of pharmacologic mechanisms in the brain involving neurotransmitter receptors.
Do you think that we as a microorganism or a macroorganism, recognizing that something is changing our molecular consciousness, so to speak, that we might, as a protective device for ourselves, try and develop a resistance? I know I'm going off on a tangent here.
I guess I'm not sure I understand the question. I'm not sure what you're getting at.
Well, yeah, I think, we were talking about microorganisms that recognize something toxic to it. And we're also organisms, and some of these things are patterns of behavior that we've developed for various reasons, for sustenance or sustainability of our own patterns. And I'm wondering if we might be able to think that somewhere down the line on a molecular level, our own brain is figuring out a way to change this because this is the way this brain wants to deal with things.
That's interesting. That's an interesting idea you pose. I think of it somewhat differently. I imagine that there might be more of a collective social response to shared concerns about becoming a medication-dependent society, as all affluent Western societies have become. And there might be a meme. I believe there are memes. There's a kind of culture thought form, a meme that's emerging, I believe, through your show, the Yoga TV show, as well as other organizations that are committed to spreading information about alternative healthcare that might lead to a collective resistance, if you will, toward the notion of taking medications for everything, that this is not a healthy kind of way to be as a society, as an informed society. So I view it more as something that might more likely take place at the level of shared consciousness within a society and be transmitted by culturally informed information in the manner of a meme, the communication of a very cogent thought that can change beliefs and behaviors. Perhaps down the road, as if genetic engineering and bioengineering and some of the futuristic ideas take place, which might involve eventually the ability to upload consciousness into an intelligent robot, there might be then the capacity to re-engineer brain circuits and so forth, so that these kinds of medications and biomedical interventions would no longer be necessary or relevant. But I see that as happening, long in the future, probably decades into the future, if in this century at all.
That's pretty interesting. I like that. Are there any cures?
In Western medicine, there are a few cures, both on the medical side and certainly on the psychiatric side. In psychiatry, on a good day, we can treat and we can ameliorate symptoms, but we can almost never eradicate or eliminate symptoms. That has to do with limited understanding in current biomedicine about the causes of symptoms of mental illness. We have some vague understanding that anxiety, as we've been discussing today, is related to changes in neurotransmitter activity or level in the brain. But we can't really say that particular changes in neurotransmitters are discrete causes of particular anxiety states or disorders. We have a very incomplete understanding of the complex web of mechanisms that are causes of anxiety disorders or any other kind of so-called psychiatric disorder. It happens at the level of immune system. It happens at the level of the fight or flight parts of the brain, which are mediated by norepinephrine and so forth. It happens at multiple levels in the body and brain. So there's not a single discrete cause. We don't understand the complex interactions between causes within this web of causes. Therefore, we don't have tools that can adequately and completely address all those potential causes. What we can do on a good day is recommend a particular medication and hopefully also lifestyle changes and mind-body practice, changes in diet perhaps, more exercise, that can indirectly address those causes and result in improved functioning and hopefully generally reduced anxiety.
You just started to allude to some of the other choices other than just medications, like mindfulness, meditation, group functions, etc. What are some of the other things, and what are some of the other ways that other countries deal with anxiety that don't have GABA and the other medications that we have?
Yeah, this is a very important point. A very good question. Within, as I mentioned, within affluent Western countries, so-called post-industrial society, we have this in hand. At least affluent individuals in Western society have this in hand, because we have access to medications that we can take, and they will typically control symptoms well enough so there aren't concerns. The symptoms are no longer impairing. You're able to function well enough if you take a medication that works, assuming it's safe. It doesn't cause side effects and so forth. I always begin. Let me talk about what I do when I meet a patient who is complaining of anxiety. I always begin by taking an inventory of their lifestyle and try to understand factors in their personal, professional life that might be driving anxiety, might be making it worse or interfering with their response to whatever treatment they may be trying. And then before I begin to even engage a patient with information about medications and so forth, I talk about lifestyle changes. There's good evidence supporting the use of simple lifestyle changes in anxiety as well as depression and other common mental health problems. For example, people who exercise even as little as 30 minutes 3 times a day will have significantly less.
3 times a day or 3 times a week?
Thank you. 3 times a week. 3 times a
week. Okay.
Yeah. 3 times a day would be better. But people who exercise as little as 30 minutes 3 times a week, thank you, experience significant reduction in generalized anxiety. They function better in all ways. People who get enough sleep function better. They tend to be less anxious. People who have general anxiety, who reduce or eliminate caffeine from their diet, of course, are less anxious. These are basic lifestyle interventions that are quite effective. After that, I often teach my patients, inform them of the value of mindfulness and mind-body work, yoga, for example, meditation, many styles of meditation, many styles of yoga practice. These things come before discussions of medications. If you, particularly among patients who are interested in doing more and other than taking medications to treat their health and mental health problems, they want to know what else can work for them. Simple lifestyle changes can often work. And again, mindfulness training can often help. People who do these things and take medications often do quite well on lower doses of medications. And they may need to take them for a shorter period of time before they can go off of them.
We agree that everybody has some anxiety at different points, and I wonder, could it be just like hunger, a natural protective device? Thirst, hunger, anxiety to warn you that something may be happening. So it's really something normal. So if you agree with that as a premise, do you think that we should be teaching children about anxiety and how to deal with it at an early age rather than waiting for someone to become pathological and then have to work backwards?
So you're pointing to the current evolutionary theory about anxiety and the pervasiveness of anxiety, why this kind of thing affects virtually everyone at one point or other in the lifespan. We're talking about a predisposition among humans, I think many other mammals, probably other animals, to have what's called a fight or flight response in the face of acute stress, a situation that might be life-threatening. It was adaptive initially to respond that way, to respond by running away or getting ready to stand and fight a life-threatening situation tens of thousands of years ago. The majority of, well, I can't say that anymore, billions of people on the planet no longer have to face life-threatening circumstances, but we still have those evolved parts of the brain that respond in the same way that they evolved to respond to millions of years ago in our early evolution. So what happens is that a stress response that was adaptive through the course of most of human evolutionary history is maladaptive. People over-respond and they respond in a way that interferes with their ability to cope with immediate stress. The parts of the brain that function in evolutionary time frames continue to take over these days, even when there's not a life-threatening event that you're facing. The amygdala, as you know, fires up the part of the limbic system in the brain, the old part of the brain, and takes over. A person has an extreme response to stress. If that continues again and again, because the stress continues, the person cannot get away from stress, or they can't manage with chronic stress in a more adaptive way, that changes brain activity. That chronic firing of the amygdala and other parts of the brain result in elevations in neurotransmitters and changes in brain circuitry that manifest as anxiety disorders, post-traumatic stress, and other anxiety disorders. So what was once very adaptive and built into our brain hardware, in many circumstances in modern society, becomes maladaptive.
So do Buddhist monks have anxiety?
I can speak to that. I've known many Tibetan Buddhist monks, at least, and many of them do have anxiety because they have an enormous amount to deal with doing their spiritual practice, particularly if they continue to reside in Asian countries. They have a lot going on. Having said that, people who are very adept meditators, monks and others who practice mindfulness meditation technique and have become very adept at that, have a remarkable capacity to get away from anxiety and to function, even in the most difficult circumstances you and I could imagine. I think that I heard a story, an apocryphal story about the Dalai Lama from a colleague of mine. They were flying over the Himalayas and they ran into severe turbulence. They thought they were going down. There was a storm, I believe somewhere over India, flying from one small town to another on one of his tours many years ago. People were terrified. Everyone looked back to see the Dalai Lama to make sure he was okay. And this person who conveyed this story to me was astonished because he was not only calm, but he was chuckling. He was kind of laughing. And they noticed that he was absorbed in watching these bits of paper that had been on the floor of the plane that were moving in a pattern in the air and the turbulence, and he thought that was rather humorous. He was so able to be so present in the moment that he was engaged fully in that experience without a mind toward worrying about what might happen in the next few moments in the turbulence. So
that would never happen to me.
That would never. Yeah, some people are quite adept. This is an extreme form of adaptability and resilience, which people who are spiritually adept can achieve.
You talked about anxiety and other diseases. I'm wondering also about end of life. We're going to be doing an interview with Katie Ortlip and Yana Beecham based on their new book, Living with Dying, which is a great manual. That's going to be an up-and-coming interview. But what are your thoughts on anxiety near end of life and the possibilities of treatments such as LSD or hallucinogenics?
It's a very good question and a very topical question in today's society, particularly in Western culture, where we can expect to live to a healthy old age. And we will have time to do spiritual and deep psychological work preparing for our dying and ultimately our death. I think there's a lot of very important work ongoing, as I'm sure you know, on psychedelics to help people feel calm, not just feel calm, but achieve states of deep insight and clarity in the moments or days before death. LSD, I think psilocybin's been used. Stan Grof has explored that. Charles Grob has explored that. In fact, they have been funded by the National Institutes of Health. I believe the organization that sponsors most of the studies that are ongoing is the Multidisciplinary Association for Psychedelic Studies, or MAPS. So my feeling is that's a fundamentally important area of research and clinical practice. It's difficult, challenging these days to find a physician or other Western-trained healthcare provider who knows about these treatments and who can guide you through them in a safe and ethically sound way. So there are layers there that haven't yet been addressed completely, at least. I think that as people, my medical training happened in California at the University of California Medical School in the peak of the AIDS epidemic in the mid-'80s, and I had the opportunity to work with many people who came in with fulminant AIDS, for whom we had no treatments at that time. We kept them comfortable, and we did what we could with very few measures at that time. As you know, Dr. Woolman. We treated them symptomatically and kept them comfortable, but we could not prevent their death after very difficult illnesses affecting their lungs and their brains and their bodies. I think that people who manage to die skillfully, I'll use that word, die with a sense of self intact in those days, are people who had done a lot of spiritual or deep psychological work. You could see a difference between the people who had done a lot of work and others who had to face the same kind of very difficult circumstances, but who had not done their work. They had not done their homework, if you will. People were often terrified. They were beside themselves. They had no idea of how to go to that next place. And I'd like to also mention that as you get close to dying, or as you have crisis that may increase your risk of dying in the next moments, many people, I believe the majority of people, have what is called a near-death experience, which I believe is kind of an evolved adaptation that permits people to feel calm and remain still in the face of an extreme situation that might likely result in your imminent death. So there are built-in adaptations in humans, and I believe probably other mammals certainly, and many perhaps other animals, other species, that can help with this peaceful transition from life into death. And I think people are understanding that more as the years go.
Yeah. We talked with Dr. Quacko a few episodes ago, and we discussed some near end-of-life experiences. And I like the way you talk about that as dying skillfully. I saw that so often in the emergency department, where people that had done their work, their homework, their spiritual process, died much more gracefully than those that hadn't. In many cases, not always.
I've seen the same. Yeah, it's hard to predict how an individual will face or embrace, if you will, their dying. It has to do with their resilience. It has to do with where they are in life, or whether they have achieved goals that have been important to them. Of course, their spiritual work. It has to do with the kind of medical issues they may be dealing with in the last moments, how much pain or distress they're dealing with. It's extremely hard to die skillfully or with grace. I think it's the hardest work that one can do, that everyone will have to do.
That's important and very true. We talk about the future of medicine and treatments for mental disorders, and technically, in a sense, from a technical point of view, we are in the future. Do you do any work with virtual reality exposures in dealing with anxiety?
I have followed the technology in virtual reality exposure for some years now. I have not used that directly in my own clinical practice, but I often recommend it and try to refer anxious patients where appropriate to clinics where that treatment is available. For many years now, virtual reality graded exposure therapy, as it's called, has been established as the most effective treatment, bar none, for specific phobias, fear of flying, fear of heights, other specific phobias, fear of spiders, and so forth. It works better, it works faster, without the risk of dependency on benzodiazepines for these kinds of phobias. So I often recommend it. I believe it's possible now to engage in virtual reality exposure therapy from your home, online, with a clinic where you can work with a professional therapist who knows the various techniques. And that's a very important fact because by definition, people who have agoraphobia, severe agoraphobia, are so impaired that they are not able to leave their homes and go to a clinic. So if they can get online and sit and do an exposure exercise or several a week with a therapist, eventually they will respond well enough so that they're no longer impaired. They can begin to get out of the house and function again. So I think there's a revolution, not only in terms of virtual reality exposure, but other kind of high-tech, we call them transformative tech interventions that can be used to treat and also evaluate mental and emotional functioning.
Can you explain it a little?
Which one? Virtual reality exposure?
Yeah, just explain it so others may get. I mean, it may be obvious, but just in case someone isn't quite sure what we're talking about now, how it works and what they do.
So in virtual reality exposure therapy, the idea is that the individual is exposed to an extremely stimulating virtual environment, a non-real environment, using advanced computer technology. For example, head-mounted display that can give you a sense of a three-dimensional experience in space. There are devices called haptic gloves that you can put on a hand that can give you the sense that your hand is moving in virtual space as you play a game, or as we're discussing today, as you engage in a virtual therapy session. Often there's a high-fidelity earpiece, and a therapist is sitting with you, or if you're doing your therapy online, is guiding you through steps and a kind of an exposure protocol, if you will, in which you're going from initially a situation that is designed to cause mild anxiety and adapting to it using cognitive and behavioral approaches for calming, such as deep breathing, guided imagery. And then in subsequent sessions, you will be exposed to more and more intense or more anxiety-provoking images, depending on the disorder that you're approaching. And you'll use cognitive and behavioral approaches to relax, deep breathing again. You'll listen to the cues and the advice of the therapist who's guiding you through and so to speak, with you in the virtual environment. And eventually you get to a point where you are able to use cognitive behavioral approaches quite effectively for self-calming, so that you might, for example, be in a virtual environment with a snake that using your haptic glove you might touch in the virtual environment and manage through regular breathing and other approaches to keep your heart rate nice and calm and avoid panic response. This takes place over many days or weeks. It's a matter of practicing it, and in doing so, changing the way the circuits of the brain that mediate anxiety and panic fire. So you're slowing down those parts of the brain, bringing them to a nice calm place through this repeated exposure and response prevention, as it's called. You learn how to not respond with panic or elevated anxiety or an inappropriate behavior that might interfere with your functioning through repeated exposure, in this case to a virtual environment, a non-real environment. So it follows essentially the same approaches that are used in exposure therapy that came, of course, decades before virtual exposure therapy, where a person would go out in an environment, a person who might be terrified of driving, have a fear of driving, and would initially sit in a car in a parking lot and use deep breathing to stay calm. The therapist would go with them and guide them through that process. And after doing that several times, they might drive around in the parking lot until they felt safe and calm and were able to use these cognitive techniques to remain calm and centered. And eventually, as you can see over weeks, the individual will be able to return to normal driving behavior, highways and so forth, through graded exposures to more intense and more frightening environments in the real world. Virtual reality exposure therapy has taken those general concepts and put them into the virtual world.
That's beautiful. And aside from just the virtual reality, they also have you hooked up in many cases to, as you alluded, to biofeedback mechanisms. So you can measure respirations and pulse and maybe even pupil dilation, et cetera.
Correct.
And then I think one of the things that might be a future treatment is when you talk about parts of the brain that are connecting, the amygdala, the limbic system, the hippocampus, all of these. I wonder if we'll be able to, at some point, actually, as human organisms, be able to focus through a meditative state or some kind of a practice to actually switch off and switch on parts of the brains that are either overacting or inhibiting that will help us in many of these mental disorders.
Mm-hmm. So I think you're talking about the area that has been called brain-computer interface. And I've been attending conferences on this for some years now. There's an annual, actually it's a biannual meeting here in Asilomar, near to where I live, the Society for Brain-Computer Interface. And these are technologies that can be used to translate information from the brain to peripheral technologies that can interpret and then provide information going back to the brain through feedback and modulate brain activity that might be undesirable or maladaptive. For example, we're talking about anxiety today. EEG biofeedback can be modulated in the context of a virtual exposure protocol, for example, using brain-computer interface technology and slow down the activity, so to speak, slow brain activity, and to alleviate symptoms of generalized anxiety and other kinds of anxiety disorders. I think that is the future. I think these are clearly technologies that are emerging and now have significant supporting research to show that they are effective and safe. And I expect that even within the next 5 to 10 years, we'll see these technologies displacing many of the medication therapies, the pharmacotherapies that we're using. I think they work as well, in some cases better, and they're safer.
I have a question, Dr. Lake, going back to simplicity and moving away from technology. Have you heard of laughter yoga?
I have not, Christine. I have to say I haven't heard of laughter yoga.
It was brought up to us, I think, back in 2010 or so when we were doing one of our virtual conferences about meditation. And it was a core of people that it was a yogi that came up with it. And so it was laughing for a certain amount of time every day, whether it be an artificial laugh where you're tricking the body and the brain and to increase the endorphins and to create balance in one's life, especially if they're dealing with anxiety and depression, those sort of imbalances, that if you are able to do it 10 to 15 minutes a day, like you would a physical exercise, even if you are not happy, but you make the sound of laughter, ha, 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 ha. And it sort of begins to trigger the chemical balance of the body. This is what came from the Ayurvedic side. And there we're seeing tremendous results where people were coming off of medications and actually healing from certain imbalances of the body, not just of the mind, but sort of creating that energy. So what do you think about that?
Well, I'm going back in my memory to Norman Cousins in the early days, I want to say in the 70s and 1980s in Los Angeles, where I believe he was hospitalized. I believe he had a heart attack. And at that time, individuals were told to have strict bed rest. Mm-hmm. And I believe, I may be mistaken about what his diagnosis or prognosis were, but he did some research. And from the hospital bed, he decided that the most effective treatment, if you will, that he can engage in would be constant laughter. So he had all of his friends bring in, at that time, video cassette tapes, and he would be laughing up a storm and having a great time. And he did get better, and he did live for several more years. Often, when I'm working with patients who are depressed, more so than anxious, I recommend what I call laughter therapy, because, as you said, Christine, it does change not only neurotransmitters that affect mental health, but it rebalances the entire body. It improves immune functioning. We know a lot about that. Laughter improves immune functioning. People who have more of a sense of humor and laugh more have more immunocompetence, if you will. They're healthier. They tend to be healthier. So if it comes up and if it's appropriate in the context of therapy, And it can often be a very sensitive issue because the last thing you want is for a patient to perceive that you may be making light of their suffering. But if a patient makes a humorous quip and it's clear that they have a sense of humor, you can use that, and you can encourage them to find a way to laugh, even though they don't feel like laughing. They don't feel like doing anything. So guys, for men, I often recommend getting old Monty Python movies, that level of bizarre.
That made me laugh.
I call it stupid boy humor, adolescent humor. For women who are more sophisticated and subtle with their humor, other things, maybe Woody Allen movies, ironic romantic comedies, So I think laughter is a very important part of mental health and mental health care. I haven't used it or recommended it so much in the context of anxiety as for depression, but it's a good idea. I'll keep that in mind. Thank you for that.
I use that in the emergency department quite often, especially with kids. If I can make them laugh while they were about to get sutured, it changed everything. Yeah. I have one more question before we come to the end of our show. I was listening to a podcast the other day that in Sao Paulo, Brazil, psychotherapists and sometimes psychiatrists go out into the park and they set up these little chairs where people can come and talk to them about their anxieties or mental illnesses just out in the park. And they seem to have some very successful results with that. Do you have any familiarity with that? Do we have anything like that in the United States?
I think it's a wonderful idea. I'm not aware of therapy being done in that way, either in group or individual form in this culture. I've been to Cuba recently, as I mentioned before we started the show today, where a group of psychiatrists and psychologists met with the leaders of mental health care in Cuba, where clinicians are much more open to going into local communities and meeting with people in neighborhoods and facilitating conversations and healing group dialogue, if you will. But I'm not familiar with such innovations in the U.S. I hope that they are taking place.
We're coming to the end of our show, James, and it's time for a health tip.
Okay, so my health tip today has to do with what we're looking forward to in the next few months, the holidays, and the predictable stress around the holidays with family and relatives who you may choose to distance yourself from most of the year. Taking time away from work might be stressful. Dealing with illnesses, dealing with any number of stresses in the economy where you live in your workplace. So my tip is to not wait until anxiety and stress become overwhelming and interfere with your ability to work and function and be in a relationship. My tip, my recommendation, if you will, is to do things in a proactive and preventive way. If you're interested in yoga, resume your yoga practice. If you've done meditation before, get out your zafu, get out your cushion, and begin to re-engage your meditation practice. If you enjoy listening to music for relaxation, for calming, take time every day, preferably a few times a day, listen to calming music. Guided imagery can be very helpful. Make sure you get enough sleep. Make sure you keep active, 30 minutes 3 times a week. Meditation, even exercise, even light exercise is often beneficial. Watch your diet. Basics, lifestyle management aimed at prevention rather than waiting until you have a problem and then needing to treat it with a medication.
Very, very nice. I agree with that, and I know Christina agrees with that.
Oh, yes.
Oh, yeah. Definitely. We're very grateful to our special guest, Dr. James Lake, for coming back again and honoring us with his experience and expertise. I'd like to thank all of my teachers and all of my healers, Yoga Hub, Christina and Segovia, and all of our world global audience participating with Magical Medical Tour. Look forward to getting together again on Magical Medical Tour, again when we travel through another quadrant of the healthcare galaxy. And until then, I wish you all optimal health.
Thank you, Dr. Lake, for gifting us with your expertise again. And of course, Dr. Woolman for another great show. We would like to thank each and every one of you for joining us in this new platform of education and information. We're grateful for your continuous support, and we look forward to hearing your feedback on how we can serve you better. You can connect with Dr. Woolman through his website, glennwoolman.com, where you can learn about his Metaphor Square Breath, or follow him on Facebook at The Medical Guide. Also, you can connect with Dr. Lake through his website, progressivepsychiatry.com. progressivepsychiatry.com. And of course, this will be listed on the website, as well as other links that he'd like to share with you, and links also to his ebooks that are available. We hope that you have enjoyed this moment here on YHTV, and it has supported you or a loved one in some way. And we invite you to take a moment to like us or subscribe to our YouTube channel. This would really help broaden the message that we attempt to share with others globally. And again, we're very grateful for any feedback and comments, suggestions. You can type them in on the site or give us a call at 818-LETS-TALK. 818-LETS-TALK. Thank you so much for joining us. And until next time, namaste.
We know that the systems of sound and hearing start in the uterus very early. And we learn about sound through vibration. And one of the interesting things that I did in my research is, there's the certain frequency of sounds that we hear in the human ear, and then there's sounds that are below that frequency and above that frequency. And within the realms of medicine and healing, Western medicine uses the sounds that are above the hearing sounds